Hi, it's Dr. Maria Lee, and today I'm here to talk to you about the early detection and prevention of cervical cancer. In 2014, 223 women died from cervical cancer in Australia. The fortunate truth is, with a few simple steps, most cases of cervical cancer are preventable. Firstly, some background information. Your cervix is the lowermost part of your uterus. It sits at the top of the vagina. Most cases of cervical cancer are caused by a virus called human papillomavirus, or HPV, which most women contract once they start sexual activity. Fortunately, most women infected with HPV do not get cervical cancer. However, in a small minority of these women, the HPV will cause precancerous changes in the cells, and if these are undetected and untreated, they can eventually become cancer. So, with a few simple steps, you can minimise your risk of cervical cancer. Number 1, if you smoke, stop smoking, because cervical cancer risk is increased in smokers. Number 2, vaccination. There are vaccines out there that guard against the most oncogenic strains of HPV. In other words, the strains of HPV most likely to cause cancer. It is a common misconception that you have to be young when you get these vaccines for them to be effective. That is not true. If you're interested, speak to your doctor. Number 3, regular pap smears. Now, most women don't like pap smears, but I have to emphasize they're very important. A pap smear is essentially where a doctor or a nurse inserts a thin plastic or metal tube called a speculum into your vagina and uses a soft brush to sample some of the cells from the surface of your cervix. These cells are then sent off to the laboratory to examine them for precancerous changes. If precancerous changes are found, your doctor will work out a monitoring and treatment regimen for you to prevent those precancerous changes becoming cancer. It's important to note that even if you've had the cervical cancer vaccine, you still need to have regular pap smears, because the vaccine does not protect you against 100% of the HPV strains that can cause cancer. So we recommend that every lady who has had some form of sexual contact in the genital region, this doesn't have to be penetrative sex, but any form of sexual contact down there, have regular pap smears. Number 4, I want you to report any changes in your genital region to your doctor as soon as you find them. So for example, if you have bleeding after sex, unusual discharge, or pain or discomfort, talk to your doctor and get it assessed as soon as possible.